Now if you want to differentiate sensory neural hearing loss, the level of it, then brainstem auditory evoked potential can help. It has got a wave 1, wave 2, wave 3, wave 5. If an examiner is very cruel maniac, he can say wave 3 is produced from there in brainstem evoked potential, but let us assume that he won't be that cruel, but still you have energy, try to understand on brainstem evoked potentials which level may problem in the visual path can lead to which wave can be a important issue. Chronically draining ear failing to respond to antibiotic therapy, you will basically think about cholesteatoma, which is destructive expanding growth of the keratinizing squamous epithelium in the middle ear. Now posterior ethmoidal sinus, where does it open into? Typically into the superior meatus, you all know. Paracusis wilsii you can hear better on the railway station than at the temple, is basically a feature in case of otosclerosis. Speech discrimination score is very low in case of acoustic neuroma out of all. It is the cribriform plate fracture which is a very common cause of the CSF rhinorrhea. Dryness of the mouth, when does it basically happen? So fundamentally it is the chordotympani nerve lesion which presents with the loss of the taste from the anterior 2/3 of the tongue, and so depending on the various levels of facial nerve injury, how do we differentiate clinically? Where will lacrimation get affected? First we need to know what is the facial nerve path from the lower pons until the stylomastoid foramen where it comes out, and depending on that which branches arise out of it and at which level what clinical features will be there, the anatomical localization is an important issue. After dental extraction there is a development of a swelling in the posterior 1/3 of the sternocleidomastoid, typically localizes to a parapharyngeal abscess. Now sinusitis is very commonly seen in the case of maxillary sinus, and in sphenoid it is least commonly involved as sinus. Diabetic patient with a black necrotic mass filling the nasal cavity is typically an example of mucormycosis, is what need to be remembered. Where will fertilization occur? Oh, this had been a 8th class biology question. Since then we had been answering the same, I hope ampulla without correction. Now Bowen's disease is typically the vulvar intraepithelial neoplastic lesion. Schiller-Duval bodies are typical of endodermal sinus tumor. Now doctor, absolute, relative contraindications of OCPs. You must learn it by heart somewhere posterior pericardium level also and go to exam, because this is one question which will come. No guessing work in the exam. Why? Suddenly you say hepatic disease. If you are not sure whether it is in relative or absolute contraindication, clean bold. The Indian cricket captain lost at the 4th run only, 4th ball only, or 2nd ball only, no, that kind of cricket score will come to mind. So this kind of questions you should not clean bowl in exam. So be very sure to fully fill your pockets with what is commonly asked. Absolute, relative contraindications, you have to be 100% sure, doctor. Now once more, what is not a contraindication of OCP? Preeclampsia is not a contraindication, but acute liver disease, migraine, ischemic heart disease, very well. When will the genitals will appear and first distinguishable fundamentally? Between 6 to 8 weeks of gestation. But what you have to do? You have to put a board outside. Don't ask for the sex of the baby. I myself did not learn it in ultrasound examination. So until delivery. Now it is all ultrasound days, doctor. In 83, 84 May, in 80s May, beginning of the 80s, twin pregnancy was diagnosed at the time of delivery. Until the time of delivery, obstetrician was not very sure. So those were the days of 1978, 1980. Now every day you will be knowing what is the baby's growth, how many new MCQs it did in the womb itself. So you can conduct a crash course of learning to the fetus. Now, the fetal effects of maternal alcohol: short palpable fissures, flat midface, short nose, indistinct philtrum, thin upper lip, not spina bifida. They're all the typical alcoholic syndrome. Chlamydial infection like gonococcus can lead to fits, Hugh Curtis. Now, what are the indications for the prostaglandin analogs? Prostaglandins maintain the PDA in a patent state, PPP. They don't close it. Indomethacin will close it, is what we have to remember. Fetal middle cerebral artery Doppler, where do you do? Suppose RH isoimmunization is there. You are expecting some hemolysis and fetal anemia. You want to monitor that. Then you will be looking for the fetal middle cerebral artery Doppler flow pattern in order to diagnose the presence of the fetal anemia. Now, McIndoe, Williams and Franks, they are all done for vaginal atresia. What is for Strassman operation done, doctor? For the treatment of bicornuvate uterus we do. The Strassman's operation is what you have to fundamentally remember. So what do you do in McIndoe, etc.? You will basically will be opening up and dilating a atretic vagina is what is fundamentally done. Now, in the newborn you can't give the, teratogenic effects can be there for barbiturates, beta blockers. Sometimes MAC sulfate can have effects on the respiratory efforts of the fetus, but erythromycin can be given very, very safely. So you can give penicillins, erythromycin, cephalosporins are the commonly used antibiotics that are not known to cause any teratogenic effects and can be given safely. You want to image the cervical tumor, MRI will score over that of the CT in the clinical staging because it can tell you what is the stromal invasion depth, tumor volume, etc., etc. Now, if you take the prostaglandin E2, it is more potent than F2 for the ripening of the cervix, and for the induction of the labor, PGE2 is the one which is used because it is very, very potent in causing the uterine contractions, whereas PGF2 is considered to be the drug of choice for the arrest of postpartum hemorrhage as a complication. Now, what is the difference between combined OCP and progesterone OCP, only pill? Combined OCP is taken for 21 days and then withheld for 7 days, dummy tabs will be there, but not so for the POP. But POP should be taken same time of the day for it to be effective continuously. So this pill need to be taken without breaks within 3 hours of the earlier day's time. If there is any breakage of that particular time, there is a loss of the entire diksha of contraception. Now, what are the conditions that can deteriorate with pregnancy? Celiac disease typically can deteriorate. Whereas von Willebrand improves, Crohn's remains static, sarcoidosis may be unaffected or improve. So they are all the differences. One more thing, if you take rheumatoid arthritis and SLE, good news for the rheumatoid arthritis patient, though bad news for SLE, is rheumatoid arthritis, a autoimmune disorder, will improve in pregnancy, but SLE will have a flare up in pregnancy. So both of them are autoimmune in nature, that's a fundamental difference. Actually, this question need to be modified. By mistake, option A got inadvertently changed. So with regard to the psychiatric disorders of the childhood, option B is true, that 2/3 have depressive form, 1/3 is maniac form, that is a puerperal affective disorders, that's how typically they present. The lichen sclerosus is a squamous cell hyperplasia, there is a greater chance of progression into an invasive cancer. It is the secondary syphilis where generalized rash, maculopapular rash is very, very classical. Sarcoma botryoides, the treatment choice is combination chemotherapy, no role for the intrauterine exposure to estrogen, and typically the mean age of occurrence is around 2 years of age for the sarcoma botryoides. Now what are the contraindications for giving a beta 2 agonistic agent like ritodrin, which will relax the uterine smooth muscle to prevent preterm labor? For you to give that, you need to take extra caution if the patient is already on thiazides. And in case of heart disease, suppose if there are twins, so you need to know the contraindications or special precautions for administration of the beta 2 agonists as tocolytics. Now if you look at thyrotoxicosis in pregnancy, the mild disease is not distinguishable from pregnancy. Subtotal normal pregnancy can very much resemble. Normal changes in the mid trimester can resemble that of the mild thyrotoxic state, and there is no need to stop propyl thiouracil 6 weeks before delivery, nor there is any need to add propranolol from 36th week, and it often improves in pregnancy, thyrotoxicosis, and subtotal thyroidectomy is considered to be a safe surgical procedure in the second trimester of pregnancy. Gynecomastia can be normal puberty, hyperplaquemia, or in the case of the carcinoma of the stomach also it can occur. Asymptomatic bacteria is implicated to be one of the important causes for preterm labor. That's the reason you must give advantage of getting a urine examination done in the early part of the pregnancy, and finding bacteriuria is an indication for treating it. Otherwise it can predispose to preterm labor is what you need to understand. In eclampsia, what happens to circulating blood volume? It is decreased, and peripheral edema can occur. What is the very common cause of death in eclampsia? It is not renal dysfunction. It is the ARDS which can kill. The commonest cause of the death is what you have to appreciate. We use GnRH agonists for leiomyomas, endometriosis, dysfunctional bleeding, menstrual asthma and migraine in any of the scenarios. Now if you look at vaginal pH, how do you describe the menstrual products? They are alkaline or acidic? They are typically alkaline in nature. So both cervical and menstrual discharges are alkaline, hence they will increase the vaginal pH is what you have to appreciate. In testicular feminization there is no action on testosterone receptors, androgen receptors. That's the reason there is no body hair, so no question of having hirsutism in that. Whereas hilar cell tumors, juvenile hypothyroidism, acromegaly, there are the various other causes. In Turner's, there can be red-green color blindness due to the absence of one X chromosome. Their bone age typically become delayed because of decreased amount of estrogen. If estrogen is not there, epiphyses don't fuse, and they typically will show the presence of delayed bone age. Now coming to the menstrual cycle, thecal cells not only produce androstenedione but also produce estrogens, is the nature of the thecal cells of the ovarian stroma. So that completes our journey, doctor.